So now I'd like to introduce our first panel. Our first panel is called Navigating a Changing Policy Landscape, and I'd like to ask our moderator and panelists to come on up. We have a change in our panelists. One of our panelists, Pi, is sick, and Katey Weber from Institute on Aging is filling in, and Katherine will let you know about that. So it's my pleasure to introduce our moderator, Katherine Kelly. Katherine is the Director of Government Affairs at ONLOC and leads her team in advocating for policy that supports older adults as they age, enhancing relationships with electeds and community partners, and supporting ONLOC's engagement in policy and planning efforts at the national and state and local level. And Katherine, I hand the floor to you.
Thank you. Okay, great. This mic is working. Thank you, everyone. Good morning. I am Katherine Kelly. I'm Director of Government Affairs with ONLOC. It is my pleasure to host our first panel for this morning's convening. A little bit about ONLOC, if you're not familiar. We are a community-based nonprofit organization that was founded 54 years ago. We created the Program of All-Inclusive Care for the Elderly, the PACE program, which is now a nationwide model of care for frail seniors who need high-touch, comprehensive medical services and long-term care. And I personally truly look forward to this convening every year. It's an opportunity to hear from local leaders, as well as to build community. And for many of our communities and agencies, the changes that we heard about this morning from Kevin, the advocacy opportunities from Supervisor Marquez, there's a lot happening right now, and it's creating a lot of uncertainty and fear in our communities. But it's also presenting opportunities to come together and to align our priorities and focus our energy. And so we really couldn't have chosen a more perfect time to be with each other today. So for this panel, we're going to hear from local public agencies and community-based organizations, or CBOs, about how their leaders are preparing organizations for this time of uncertainty. And during this panel, we will gain a practical understanding of how these organizations are preparing to weather known and unknown policy and budget changes. So I will go ahead and briefly introduce our panel before we dive in. And we might be seated a little bit out of order, but I'll just go off of my notes. Kimi Watkins-Tartt is the Director for Alameda County Public Health. Faith Battles is the Assistant Agency Director for the Alameda County Department of Aging and Adult Services. Lara Calvert is the Executive Director for Spectrum Community Services. Levon Gibson is the Aging and Family Services Administrator for the City of Fremont. And then Katey Weber is the Director of Strategic Initiatives for the Institute on Aging. So thank you all for being here today. So our panelists will share their unique perspectives as I take them through a series of questions and discussion. Some of our panelists have also prepared slides that will accompany their remarks, and Danielle will be helping with that. And then after our discussion, we'll have time for Q&A. And as questions occur to you, please write them down on the cards at your table, just one question per card, and then the volunteers will help collect them. Okay, so I would like to start with Kimi and Faith. And as county leaders, how are you preparing your agencies and the programs that serve older adults to weather the coming policy and budget changes? And what communities or populations and programs are you most concerned about? So, Kimi, we can start with you.
Okay. Good morning. Happy to be here. Wish we were having a different kind of conversation, but I think that it is good that we have this community so that we can share information and strategize. As we navigate the next few years, we all know that there's a high degree of uncertainty in our environment, and our health agency remains committed and steadfast in our commitment around the health and well-being of everyone in our county. We will continue to proactively advocate with and on behalf of residents and clients and our partners. And what's important for us to say and for you to hear us say is that our doors remain open. We encourage those who need services to access them as you would regularly. We know that people are going to be fearful, but we really want to support everyone in using the services that are available. We currently and will continue to work closely with our partner agencies, including social services, with whom we share several populations, and are working closely with community partners in different policy spaces where work is happening, such as the Age-Friendly Council, Developmental Disabilities Council, our Community Navigators Group, led by Health Equity Planning and Policy Team in the Public Health Department. Our agency has established recently a Federal Policy Implications Working Group, which is an internal body that we set up to make sure that we know what's happening as quickly as possible and that we can mobilize ourselves internally for action. Some of the examples of the work that we're currently taking on is reviewing the proposals of P2025, Project 2025, and other items that are being released by the federal administration, creating a space to regularly and in a timely manner across our entire agency to coordinate and to be really strategic around alignment and to strategize. We're also reviewing and generating local data to demonstrate the impacts. We're analyzing policy, also gearing up for messaging and advocacy efforts, working with community partners to be prepared for community engagement and outreach, as well as continuing to track closely what is happening so that, again, we can be ready for action. And I know that a lot of conversation has already happened about what we think is happening, going to happen, what may happen. And I think what's key, and I will continue to say over and over and over again, is that while we don't know exactly what will happen, what we do know is that we have to be able to move fast. And we also have to cover a lot of territory and not focus exclusively in one particular area or the other. At a high level, and I think this has already been covered, but I'll just say, generally speaking, that local governments, of course, benefit from and provide services through a mix of funding, federal and state funding. And so while we may not feel the effects of changes at the federal level immediately, if there are significant cuts, rule changes, eligibility changes, programs being eliminated entirely, eventually it will trickle down and we will feel those cuts. And they usually for us, they come through the state. And so we are monitoring again very closely to be able to anticipate what might happen. Next slide, please. Some of the programs that you all have already talked about that affect public health services a lot are those programs that affect Medicaid, as well as those programs, those funds that affect the Department of Public Health. Often that comes through Health and Human Services, comes through CDC, Centers for Disease Control. A lot of our public health services are funded through those mechanisms. And so if there are changes there, if there are cuts there, we are concerned about being able to maintain basic public health functions. And so there are potential challenges, and we're remaining committed to the populations that we believe and what we're hearing are going to be targeted. Older adults, people who are undocumented, BIPOC, LGBTQ populations, and those who have intersectional identities, we know are going to be severely affected if any of these proposals come to pass. And again, we are mobilizing ourselves to protect and to stay leaned in so that we are able to cover the bases. Immigration, housing are areas of concern as well. Some of the proposals that we're hearing about ending housing first policies. That would be significant. Public charge concerns, and which cause, of course, people to avoid services. We saw that the last time, that there was a lot of work we all had to do to keep our communities informed about public charge. There was a lot of advocacy and comment on those policies the last time, and we are anticipating that this will happen again. Also, housing and community-based services, long-term services and supports are areas of concern as well. Patient confidentiality and privacy rules could change. Currently, the Public Health Department really we're still held and bound by HIPAA. And so during the last administration, the last time, we were able to really stand firm around HIPAA privacy. But again, if more attacks come to erode that, then there could be some impacts there. Next slide. What I wanted to also say, can you go back? I'm sorry, I apologize. Lastly, in terms of public health services, there has been a lot said about this administration's questioning and concerns about the efficacy of vaccine. We do anticipate changes to funding that supports our vaccine programs. And so we are trying to prepare and gear up for that. Not only the availability of subsidies for the vaccine program, but also sending a signal to our health plans that vaccines are optional and that they could cover them or not cover them. Those are concerns we have, because that then would affect and have a chilling effect within several health plans in terms of whether or not to cover certain vaccines if the signal is sent out by the CDC that this vaccine or that vaccine is optional. And so those are the kinds of things that we are concerned about and looking for in the Alameda Health Agency. Next slide. Okay. I think this might be my last slide. And so our priorities remain what they have been for quite some time. We want to continue implementing CalAIM. However, if there are changes to Medicaid or if things are cut, that of course will impact that. Medi-Cal expansion, that has been very significant in California and significant in Alameda County in terms of providing desperately needed coverage to thousands and thousands of people in our county. Increasing access for IHSS, also critical, and my colleague will speak more about that. Maintaining our public health infrastructure. As you all know, and we spoke about often during our pandemic response, that nationally we were not as prepared as we wanted to be, and we do worry that we will be brought back to pre-COVID preparation levels. And this is not the time to be at pre-COVID preparation levels. Mm-hmm. In addition, behavioral health services are also, of concern. And lastly, but certainly not least, our work and advocacy around digital equity. That is still a huge issue. That is not something that we have completely completed work around. We are just really starting that work, and this is not the time for that to be cut and eliminated, and it will interfere with communities being able to get information, maintain connection and services. And last but not least, our community health improvement plan with our public health department. We maintain our priorities of access to physical, behavioral, and oral health, economic stability and opportunity for residents, and last but certainly not least, community safety. I think that's my last slide. Next slide. I think that's my last slide for this segment. Yes.
Great. Thank you, Kimi. Faith?
Thank you.
Would you repeat the question?
Yes, of
Kimi
course.
said a lot, and I want to make sure I follow up with her.
Of course. How are you preparing your agency and programs that serve older adults to weather coming policy and budget changes? What communities or populations and programs are you most concerned about?
Okay, very good. So just to level set a little bit, I want to make sure everybody understands my responsibility as the Assistant Agency Director of Adult and Aging Services. We have all of the protection programs for older adults in the county. We have Adult Protective Services, that's APS. We go out and investigate allegations of abuse or neglect for individuals 65 and older or dependent adults. We have In-Home Supportive Services, IHSS, that is helping older adults and dependent adults and even some minor children be able to live in their homes successfully with some support for their activities of daily living. We have the Veterans Office, and that's self-explanatory. We serve veterans, make sure they get access to their entitlements and benefits, and so do their beneficiaries. We have the Office of the Public Administrator. That's an interesting office. That office is responsible for dissolving the estates of deceased individuals in the county that do not have a will or a trust or an appropriate and able family member. That's your plug. You need a will and a trust. Mm-hmm. You don't want other people deciding what to happen with your belongings. Get a will or a trust. Okay. Service announcement. We also have the Office of the, and you're never too young. Young people have stuff that other people want too. All right. Get the Office of the Public Guardian, Conservator, Investigator. So individuals that are a danger to themselves or others, we manage their person and their estates, or individuals that may have cognitive issues, we will also be a guardian for them. And we also have the Area Agency on Aging. Mother, you made a comment about not having a hard copy of a resource. That made me sad because we have tons. So get your pen really quick. I want to give you a number. If you want to have a hard copy of senior resources in Alameda County, I want you to call my people. We have a senior information and assistance resource line. They will send you a copy. The number is 1-800-510-2020, or you can dial 510-577-3530. 577-3530. That's the first place you want to go if you're asking questions about resources for older adults or dependent adults. It's a warehouse. And if they don't answer you, tell them, leave another message that says, Faith said to call you. Okay? All right. So, having said all of that, well, I'm sorry, what'd you say? Absolutely. 510-577-3530. Dial that number. We'll get you a packet of resources. And it's according to areas in the county, so we can help you with that. So in terms of how we're preparing our agency and our programs that serve older adults to weather the coming policy, I'll be 55 in August, so I need my glasses. Okay. We're doing a couple of things. Our agency has an Office of Public Policy, our policy office. Their charge is to make sure we are aware of what is coming from the federal administration or the state administration. They present it to our agency executive team, and we get mobilized around understanding how those changes will impact us. Kevin did a fantastic job this morning, didn't he? He laid it out nice and plain. And there are two big issues that he's talking about. And the big ones are Medicare, Medicaid, and immigration. In my department, the majority of the people that we serve that are older adults are getting some type of entitlement, whether it is CalFresh, SNAP, food stamps, or Medi-Cal. In order for you to receive IHSS, you must have full scope Medi-Cal. And we have over 25,000 individuals in this county that receive IHSS services. That means my team members in IHSS have to see 25,000 people every single year. It's really, really difficult. So we're trying to get prepared for that. We also want to make an effort to make sure community understands that adult protection services is not your first stop when you have an issue. Your first stop is AAA, Area Agency on Aging. That is really supposed to be the buffer to get you connected to services early so you don't need APS later. You understand what I'm saying? When people come to adult protection services, raise your hand if you heard of CPS. Everybody knows CPS? Everybody knows CPS. I used to work at CPS for 20 years. I'm a former foster youth, so I know that system very, very well. APS is the equivalent of CPS. Typically, you want people to come to APS when they've exhausted all their preventative measures. We see clients, unfortunately, that don't know about the preventative measures, and by the time they come to us in APS, it's bad. We have homes where people are living in conditions where they can't even navigate their way from the front to the back because they have garbage, paper, et cetera, piled up because they took a fall and they haven't been able to get to the restroom or the kitchen. And we have to come in and implement something to help them get out of that situation. We've been fortunate because there's something called Home Safe, but Home Safe is going away in 2026. It gave us a lot of money to help clean out homes that come to our attention through APS. That's going away. I signed probably on average $5,000 for one home to get cleaned out. That's going away. So we want you to get engaged early on with your needs through the AAA. All right, that's that number that I gave you, Mother. You remember that 510 number? That's that number, okay. We also want to be able to leverage funding. That's a fancy way to say get all the money you can from everywhere you can, okay? So that means there's one way that we do that, particularly in my field of work. Our employees do what's called time studying. They basically have to report how they spend their time, and then we can determine whether or not we can get money from the federal government to pay for that. The county wants to pay the least amount of money possible. You want the feds to pay you the most, the state to pay you the next, and then the county can offer money out of its budget. If we are time studying properly, Medi-Cal is a cash cow. If you can say, I serve you and you have Medi-Cal, I can time study that and get reimbursed for serving you with Medi-Cal from the federal government as an example. We want to do that. We also want to do what's called braiding funding. It's basically using all the money that you can from everywhere you can to serve the same purpose, all right? We haven't been historically very good about that. It can be very complicated. It requires a lot of oversight, but we want to move forward in that direction a bit more. And when I said that APS is not your first stop, it's not to discourage you from calling APS if you think somebody is being abused or neglected. No. But if there are issues that don't amount to abuse or neglect and just need some resources, I want you to go to AAA. Because the number of cases we receive in APS is astronomical. And it's very hard to touch all of those cases. You know how you go to the doctor and they triage you when you go to the emergency room? They're going to see if all of us showed up at Kaiser, that's my health care. If all of us showed up at Kaiser, they're going to look at the person that is the most sick first because they don't have enough doctors to see all of us. If you've been to an emergency room, you know what that looks like. APS, CPS, it's the same thing. So we want to soft touch people early on to get you services early in the game, as opposed to you coming in your greatest point of need and we're having to scramble to be able to help you. The other thing that we want to do to prepare for these policy and budget changes, going back to APS, we need what's called an alternative response system. And this is what that means. Exactly what I said earlier. We pivot to a community-based local response for those individuals that have lower risk, not the big risk. APS should really be for individuals that are at the very, very end of their cliff, not the individuals that we can intervene with earlier. So that means having enough staff. That's a big deal. If he's talking about IHSS services and it's 25,000 people, 60 IHSS social workers is not going to cut it. I need more workers. I need funding to hire more workers. I need people that want to do this work, and I need the ability to bring them into the door very quickly. One more thing, a couple more things. We work with lobbyists. We have lobbyists on the federal level, on the state level, to find out what laws are coming and how we can suggest that the Board of Supervisors support this issue, support that issue. And we also partner with our fellow surrounding counties. When we talk about undocumented individuals that live here, in IHSS, there is a huge amount of individuals that could provide IHSS services for their family members. Those individuals are undocumented and they're an untapped resource. Have you heard that? San Francisco tried to put forward some legislation for the state. It didn't make it very far, but they were suggesting that the state allow undocumented individuals that have a certain type of taxpayer identification number to be IHSS providers. We know undocumented immigrants, people from other countries, have a really tight community and they take care of one another. The fact that we can't allow her undocumented niece to care for her, and now she has to find a stranger to care for her, that makes it really, really very difficult. And it could add to our economy as well because those individuals are working. So we're looking to try to jump on to legislative suggestions that make sense for the work that we're doing as well. One more thing, raise your hand if you heard of the World Health Organization, WHO. All right. So there was an executive order that was signed to say we don't want to be a part of World Health Organization. That's significant. That is significant. AARP, American Association of Retired Persons, I got my AARP card. They sent it to me when I was 49. Wait a minute, that's too early. Wait a minute. But you better believe I started using it for those discounts immediately. So with AARP, we want to be an age-friendly county. We want to be an age-friendly city. All of the various cities, Fremont, shout out to Fremont, excellent age-friendly city. That's a part of the World Health Organization. They sponsor that across the world, that we should be age-friendly. If there's an executive order to suggest that we don't need to be a part of that as a country, what does that mean for our efforts to be age-friendly? How does that impact our ability to be age-friendly? The communities that I'm most worried about, immigrants and undocumented populations, I'm very worried about them. I'm worried about our older adults that have really very little financial resources and community support. And I'm worried about housing insecure individuals. All your best wishes for people in Southern California that lost their homes in that fire. They were all not billionaires. They were all not millionaires. Some of them were older adults that have had their homes since the 40s, the 50s, the 60s. They paid it off and they live on a very modest income. 70, 80, 90-year-old individuals. How will they be housed? How will they be housed? How does the county, how does the city absorb those really most vulnerable individuals that don't, frankly, have a lot of time to rebuild their lives? And they should be relaxing in the home that they purchased many, many decades ago. Thank you.
Thank you, Kimi and Faith. So a couple of items just to highlight, and thank you, Kimi and Faith, for sharing your perspective, your leadership, helping to educate us about the critical role that the county is playing in this changing policy landscape and environment. I heard a couple of items, certainly a call to action to have our wills and trusts, no matter what your age. The doors remain open for services. And the county is working very hard to combat any fear that may be going through our communities about accessing those services, to look at accessing soft touch programs, not waiting until an issue is becomes so complex that APS is the last resort. And then also looking at partnerships across county lines, being in the Bay Area and thinking about the place that we sit as a region. Those partnerships are really key. And I think that's what a lot of us are here for today, is to learn about partnerships and to build those partnerships. So now I'd like to pose the same questions, which I'll repeat, to our community-based organizations and city representatives. And as a reminder, please write down your questions on your note cards. So for Lara, Levon, and Katey, how are you preparing your organizations and the programs that serve older adults to weather the uncertainty and potential policy and funding changes? And what are you most concerned about? So Lara, we can start with you.
Thank you. The first thing that we're doing to prepare ourselves, I don't have to tell this room, it's being here in this room, right? It's educating ourselves. It's being, making sure we're reading Justice and Aging's emails, keeping on top of what might be coming at us, right? And so that we're not shocked and surprised by it. I was thinking about this last night. January 24th, 5 years ago, January 24th of 2020, right? We started hearing about this virus that was going on in China. We sort of said, oh, it's probably staying there. It's in China. We had no idea at the time that it was going to turn into something that I hadn't really heard of before, this shelter in place, and really what that was going to mean to us 2 months later, and what it was going to mean to us to deliver services to the adults who rely on us every day. 3 weeks ago, the CBOs in Los Angeles County did not know that the Santa Ana winds were going to come up and start the most horrendous firestorm that they've ever seen. We do not know what the challenges are that are going to meet us this afternoon or tomorrow or next year. All we know is that we will face another challenge. So how do we prepare for that? I'm concerned that we don't have the extra supports from COVID funding anymore that helped us get through the last several years. We aren't going back to normal because we are in a new normal now, right? And how are we going to keep our organizations ready to serve every day in that next crisis? We're in the people business. I'm here to take care of people, okay? I have 3 sets of people to take care of. Number 1, our clients who rely on our services. Those clients get served through relationships with our volunteers and our staff. And our staff support our volunteers and our clients. And it's a circular relationship. And kind of like a smile is contagious, it becomes contagious. It is wonderful when our clients reach back out to our staff with huge appreciation and gratitude, right? It then feeds my staff soul for the good work that they're able to do every day. And it builds a stronger community. What I fear is that I'm not going to be able to help every person that needs our help. I'm already seeing that in our inability to help everybody who comes to us for help with their PG&E bills. Out of eligible households who come to us, we are turning away 40 to 50% of them right now because during COVID, we had so much more money and everybody knows about us. And now we can't keep up with the demand. It breaks my heart. People don't understand. They say, I income qualify. How come you can't help me anymore? And we have had to make those hard decisions to prioritize and help the neediest of the needy in our county. Our volunteers, who are they, right? And why did they come to us? They're from this community, and in return, they receive that joy and those positive pieces, and they have the capacity to do that. Our staff, over 85% of Spectrum staff live here in Alameda County and serve their neighbors here in Alameda County. They do get that joy, but at the end of the day, they need to pay their rent. They need to be able to earn enough money to meet not only their basic needs, but fix their car if their car breaks down, buy diapers for their toddler. I had a staff member who came to me a year ago and she was like, I don't qualify. I don't make enough money to buy diapers and childcare. And you pay me too much to qualify for the programs. Yeah. And I had a choice at that point, right? Do I say goodbye to this person who we've invested money in, who we've trained, who has the heart for this, for giving back, and who is doing really good work? Do I just say goodbye and have a revolving door and have turnover in our organization? Or do I find a way to make sure that I'm paying her, and not only her, but everybody in our organization, a living wage? we have to be paying people a living wage so that they have the capacity to serve our clients. This slide has a lot of lines on it. It's over 10 years. The line on the bottom is the yellow one, and that is the California minimum wage. And 10 years ago, my organization was chasing minimum wage. We were trying to keep up with paying people minimum wage. And the line right above that is the city of Oakland's minimum wage, because different cities here in Alameda County started saying, hey, this isn't enough to live here, and how do we do better? Then there's a couple little dots there. One of them's green, yeah. So something happened last year. In the state of California, fast food workers, they started getting a minimum wage of $20 an hour. Mm-hmm. That was not the same as a minimum wage. I was paying most of my people, but it was like all of a sudden that bumped up everybody, right? Healthcare workers, while they're on their way to get to 25, they're already at $23 an hour, okay? This is the market rate. When people need to pay their rent, as much as they might love to be doing service work, right? The reality is they might leave a place of service to go work at Target instead. And there's nothing wrong with Target. We all go shopping at Target. We need people who are good there. But if we're taking care of our community, we need to have that. That line on the top, that blue one, that's the MIT puts out a report every year showing the living wage for every county in the entire United States. That's Alameda County's living wage. And between 2023 and 2024, it went up 28%. And at the same time, as an employer, my Kaiser premiums went up 15%. My general insurance went up 22%. Our Ross food, I don't remember. Anyway, it's tough when the government's funding is going down or is flat. So I can't rely on only the government to solve this issue for us, right? So how am I going to have the best people to serve our clients? Steady workforce who know our clients, who build relationships with them. And that's how we provide the best services. I need to make sure that we're advocating on the government level, but I need to be looking outside of the government to solve these issues. We have to find a way to bring in more people who are winning in this economy. The people who are winning in this economy are those at the upper end of the income levels. We are in a state, everything that we've been talking about, the income gap is going to continue to get wider in this country. We are not on a path to narrow it. We need to be in the room with people who are talking about flying to Switzerland for the weekend to go skiing. We need to, or oh my gosh, my bill is so high, and I can't imagine if they, don't continue the tax cuts. Well, let's show them the good things that we're doing with their tax dollars. Let's show them the positive effects that are happening in their community with their tax dollars, and how that they can invest their money that they are making in the stock market into our organizations so that we can help more people right here in the communities that they live in. I'm going to leave it at that, Frank.
Thank you, Lara. Thank you. So now we'll move to Levon. How is the city of Fremont preparing the programs that serve older adults to weather the uncertainty and potential policy and funding changes, and what are you most concerned about?
Good morning, everyone. Again, my name is Levon Gibson, Aging and Family Services Administrator for the city of Fremont. For those of you who don't know about Fremont's one of the premier social service providers in the south of Alameda County. We have a mobile mental health program that's dedicated strictly for older adults. And I guess we are unique in that we have a human services department. Let me start there. We have a human services department under the city manager's office. Within the Human Services Department, we have my department, which is Aging and Family Services. We have our Family Resource Center, and then we have our Youth and Family Services. Within our Aging and Family Services Department, we have mobile mental health programs. We have case management programs that include case management for APS, also MSSP programs. We have a family caregiver support program. We also have a health promotions program. I also have 2 Age Well centers, which are rebranded senior centers. And the referrals come to us through a senior info line where an older adult or their family member or a loved one can call in and get resources that not just unique to Fremont or Union City or the Tri-City area, but to the county as well. I'll preface this and also say that I've been in my role just under 5 months now.
Great job. Great job.
I'm taking over and stepping into the shoes of the great Katherine Grimshitz, who's sitting over there. Thank you. Thank you for all the fun that you're leaving me right now. I appreciate it. But we do a lot of great things, and that's a big shout out to Suzanne Shinfield as well, the former director of the City of Fremont Human Services Department. And they've done a lot of work to provide the services in the county that we do and in the city. And so after hearing Kevin this morning, I was going to come and talk about budget review and supplemental funding. But in review and just to kind of echo what Kevin said, there's no way that we would be prepared for the budget cuts that will come if this administration gets what they want to do. And so I want to focus on my last 2 points of being prepared, and that's really strengthening the partnerships that we have, strengthening the partnerships we have with the community organizations, strengthening the partnerships that we have with the county, with our local hospitals. It's very important that we do that. And we need to continue to grow those partnerships. We need other people to come together. This is the first time that I've been associated with the Senior Services Coalition. And, I immediately was looking for a way that I could assist with advocacy. I came from Contra Costa Adult Protective Services. Before that, I was with Washington State Adult Protective Services. So Adult Protective Services, protecting vulnerable elders from abuse, exploitation, and neglect is something that's close to my heart. And so going back to the Home Safe program, I think that is a valuable program that creates a lot of opportunity and offers individuals in those situations a way to get out of those situations. I know in Contra Costa County, when I was doing that, we had an 80% rehousing rate at that point in time. And so seniors really rely on those supports that come from the county and ultimately that comes from our state budget. And if that money is going to be affected from this administration, we need to step up and make some noise, really, and be proud of all the services that we provide in this state, and don't let them be taken away by this administration. And so being able to strengthen and big up our voices, we need to be together and act as one. We're looking at ways to notify our community. We have 2 amazing Age Well centers that have over 6,000 people that visit them in a year. We provide space for that to do that. So if you are wanting to come to the South County and want to get access to space where you can advocate and for what's going on across the state, what's going on across the nation, please come and talk to me. Advocacy is kind of one of our biggest tool. It is our biggest weapon. Going back to the Human Services Department and my department, we get 60% of our funding from outside sources. So that's from grants, from the county, from private funding. And so to have Medicaid or Medicare, Social Security be cut, that would be devastating to our budget. That'd be devastating to the people who receive our services. we would have to heavily rely or push on the city to see if we can get extra resources. You know, the city of Fremont has a lot of resources. We have a new mayor who came in, Mayor Salwan, who was at our Age Well Center breakfast yesterday. And those conversations are going to be had with him and our city council, and how we can better support the county and other organizations in the county as well. Key concerns of populations: Fremont is a very diverse area. We have one of the largest Afghan refugee populations in the area. I was just with the Afghan Elderly Association yesterday at a lunch, and we were talking about, as executive orders were announced, there were people in planes who had been approved to come to the United States, and those planes were turned around and stopped, and they're stuck in some of their Qatar and other countries. And so those type of populations are who we're trying to advocate for and who we need to fight for. Our caregivers, our family caregivers. We have a family caregiver support program, and these are some of the individuals who already are lacking resources and are reaching out. Well, there's not a lot of respite care that they can access in the South County. And so without funding to support family caregiver programs, without funding to support just daily needs of ADLs, just daily needs to get out in the city or to access transportation, there's going to be a huge strain and a much larger amount of stress put on these individuals. Our staff, if we don't have funding to keep our programs going, to fund our staffing, to keep individuals out in the community providing services, everyone's going to suffer. Recruitment and retention issues due to retirement, early retirements and burnout is going to just go up. How do we combat that? How do we do that together? At the end of the day, I hope that we all can come together and bring resources and bring one voice and really advocate for those who need it the most. And I just want to give a big shout out to Wendy and the Senior Services Coalition for throwing this and involving me and everyone up here on this panel. I am so, when I was hearing Kevin talk this morning, I got a little emotional. My grandma was an RN for 32 years, and she kind of got me into this work because she was a caregiver pretty much from my birth throughout my whole life. And she had a stroke 2 years ago, and we've been trying to connect her with services and going through the whole, the process of getting her services because she's bedbound now. And I just think about her, and I think about all the people that are in her situation, and I think about all our unsheltered, vulnerable seniors who are out on the street. And I just hope that we can fight what's happening across this federal level, because we are California. Going back to what Lara said, that this California is one of the number one economy in the nation, right? So we shouldn't be having some of the issues that we are. And with this administration being against California, so in particular, we're going to have a long fight, but it's something that we can come together and overcome at the end of the day. So thank you, and I appreciate it.
Thank you. Thank you, Levon. Thank you. And thank you for sharing your personal story as well and your connection to this work, because it's the stories that really ground us in what we're doing day to day. Fremont is also my hometown, so I'm just very proud of all the work that's being done. So thank you. And so now we will hear from Katey with Institute on Aging. So how is IOA preparing your programs that serve older adults to weather the uncertainty and potential policy and funding changes? And what are you most concerned about?
Thank you. You can go to the next slide. Yeah. So just to give a little background on Institute on Aging, because I know in some ways we're newer to the Alameda County area. We I just want to give some background on our mission. So you can see our mission up here. We work to enhance the quality of life for older adults through many different strategies. And if you go to the next slide, we operate in a number of different counties throughout California. So in this way, one of our main focuses, if you go to the next slide, I'll just kind of focus on this, is really building flexibility into our operations. So we recognize that, like Lara said, when it comes to funding, we have to really think about how we diversify our funding. I think as an organization, we're fortunate that we offer so many services because we have partnerships with Alameda Alliance to provide CalAIM services, which is where a lot of our expansion has happened in recent years. We, in partnership with OnLock, have a PACE center in San Francisco and a number of other community programs in San Francisco. We have a home care division that provides home care throughout the Bay Area. And we have a friendship line, which is the warm line that all older adults can call if they're feeling lonely or socially isolated. And if anyone has questions about that, please let me know. We want to make sure everyone has access to that resource throughout California. And then we have Compania, which is our dementia care program. We have an enrichment center in the Presidio, and then we also do caregiver coaching throughout California, which is one-on-one coaching and support groups for people caring for people living with dementia. So that's a number of different services. In that way, we also work on cross-training staff. So they're able to, like, as funding flexes, we're able to move them throughout the organization. We want to make sure that we keep those them as assets for the organization, for our communities. We have seen, we used to provide MSSP services. The funding was flat for that, and we ended up passing that to a different organization. But we were able to relocate a lot of our staff to other programs within IOA. And then one area I really want to focus on is we take this whole person care approach. So recognizing that it's not just the individual client, but also their family and their broader support system. Like, of course, if an older adult is fortunate enough to have that support system, and we know that's not the case for everyone. But I wanted to share a story that Pi shared with me, and Pi's our senior manager of care management programs and leads the Alameda County program. And I live in Oakland, and I share an office space with the Alameda County team. So it's really a privilege to be able to see the work that they're doing on a daily basis. But so this story is about Juan, who's a 45-year-old single father who experienced a stroke last year. This drastically altered his life. He lives with his 10-year-old son and his 72-year-old mother in an accessory dwelling unit, an ADU, with limited heating. His mother, who is undocumented and has her own health challenges, has been a crucial support system for him despite her own vulnerabilities. And that, hearing everyone talk about the challenges to immigration and the support for undocumented community members, it's concerning. And it's something that we're taking very seriously at IOA, especially considering we do a lot of Medi-Cal is a big support for a lot of our work. And so we want to make sure that people can stay enrolled and covered. But all of this is to say, so his mother, through the support of our care management services, and then also with his mother, we were able to secure him an assisted living waiver, which got them new housing, provided them with more stability. His mother is being served by the Area Agency on Aging, so thank you. A care manager. And IOA helps address her specific needs that she needs. We're very focused on meeting clients where they're at. And it really highlights that we're not just serving the individual who's our client in our care management services, but we're serving their family and by extension, their community. And you can just, think about the network effects. Then just thinking about, preparing more for what we hear. It's interesting when Pi and a couple of my other team members and I were talking about, okay, what do we want to cover on this panel? This was a couple weeks ago, and it was just, we knew somewhat what was going to happen, but we didn't know the extent to which it was going to happen so quickly, and how much more is coming our way. And hearing Kevin talk about it, it's like there's as prepared as we feel we are, it's impossible to be fully prepared. It's like preparing for a pandemic. Preparing for a fire. Like, you do your best, but you don't know what's going to come down the line. But I think that what really resonated with me that Kevin was talking about was the importance of continuing to build the services that you already were planning to build. So we don't want this changing landscape to change the strategy that we had in mind. So I work on our strategy team. We do this vision planning process called the painted picture, which is a 3-year plan where some of you may be familiar with it. You essentially envision where the organization's going to be in 3 years. And so we have an idea of where we want to be in 3 years. And in some ways we're on track, and other ways we're hitting roadblocks. And of course there are new ones. But it's important for us to continue to make sure that we're providing the services to these older adults. And one way that I work on this is also, we talked about technology a little bit, and making sure that we have access to the resources that are kind of traditionally how people access information. But also we're exploring pilots in some of our more rural areas, or areas you think about Alameda County is very diverse geographically too. We are doing a pilot now in Southern California where we have this product that's like a set-top box for your TV, almost like a Roku, but has a camera built in, and everyone's like, I don't know about cameras. But it's basically given our care managers an opportunity to connect more frequently with their clients. It's given them the opportunity to, with their clients' permission, see into the living room where the TV is placed, or in their bedroom, if that's what they prefer, their privacy screens. But it's been really, I got an email from one of our care managers who's piloting this first, and she was like, the client loved it, we loved it. It was everything that we kind of thought it would be and more. And it's from my perspective, when it's always a risk when you're introducing new technology like this. But that's an area where we're continuing to build and don't want to slow down, but we meet our clients where they're at with it. So they're involved in the process all along the way. And then, just to summarize, I think it's really whole person care, recognizing these kind of diversified funding streams, building flexibility in the workforce, doing all of that cross-training. And then I also wanted to echo what Lara was saying about kind of needing the wealthy individuals in our society to really step up. I think this is an area where we're going to need to see more philanthropic involvement. And that's not just smaller donations, but that's really helping to reinforce the infrastructure that we all rely on.
Thank you, Katey.
So thank you again to Lara, Levon, and Katey for your remarks and your leadership. There's a lot happening in our communities, and I think we're just so appreciative of you all being here today. So we're going to shift now to talk about prizes. So these are concrete state or local policy proposals or initiatives that are must-haves for your organizations. And so I'll ask our panelists to keep your comments as brief as possible, maybe 2 minutes or so each, so we can have time to get to a question or two and stay on schedule as much as we can. Although I know we could probably spend all day talking. So the question for all of you, we can just go down the panel, starting with Kimi, is what prizes are you keeping your eyes on for older adults you serve and the programs they rely on? And then what can community partners and stakeholders, all of us in the room, do to help? So Kimi?
Thank you. I will just say very quickly, the Public Health Department has quite a few programs that rely on Medi-Cal funding. And so for us, really keeping Medicaid benefits in place is critical, because without that, a lot of public health services all but evaporate. And many of those services are services we provide to older adults. I also want to make sure that the gains we've made with the California Department of Public Health, adding a new initiative around Alzheimer's and related dementias. We were fortunate in our county to just recently get funded for a planning grant. We were not successful the first time out, and we want to really see that work grow. Alzheimer's is now the 5th leading cause of death in Alameda County. And so this is important work that we continue to move forward. In addition to that, some of the other work that we've been doing for a while that we have taken for granted, which is really preventive and community building with nutrition services, bringing people together around diabetes self-management, nutrition education, the things that keep people healthy. Last, what I'd say around what we need from you, there are a lot of things we can do. We talked a lot about partnerships and a lot about, advocacy. What I would add to that is we want to connect with you at the tables that you are setting. And so please invite us. If you are setting a table where work is happening, please invite us so that we can lend our support. Thank you.
Okay, I'll give you 5. Number 1, the County Welfare Director Association, it's called CWDA. They are advocating at the state level to adopt a new budget methodology for IHSS administrative funding. Simple and plain, they want more money to come into counties that have to fund IHSS because the cost to fund it is not what it used to be. Yesterday's price is not today's price, it's that. So we want to be able to get the legislator at the state to give more money to counties to be able to fund IHSS. It is the most rapidly growing section of services in the state. 4% every year increase in people that receive IHSS. The second is, I have a Master's of Social Work from San Francisco State. I was able to get that because they had what's called a 4E program, and that is a program that will say to you, I'll let you come and get your master's degree in social work if you agree to go work for a foster care system for 2 years. That's how you pay it off. We want the same thing to happen for people that want to come and work in adult protection services or gerontology. It's not really a field that people, shout out to that. It's not really a field that people want to go into. But if you tell a student loan debt is real, shout out to the Biden administration. They forgave $70,000 of my student loan. That's a real thing. So if you have people that want to get their Master's of Social Work and they don't want to have to pay for it, that stops people from going to get their advanced degree. This is the way that you do it. We're looking forward to the state continuing with that. Governor Newsom gave out the January forecast of his budget. It had very little cuts, if any, to adult and aging. We want that to be the same in May. Last year, he almost gave us a heart attack, didn't he? So we want him to do the same thing in this fiscal year that he did in the last fiscal year and to keep it. Another thing for IHSS that would be a prize is if we have these 25,000 people that receive IHSS, every single person that receives it has to be reassessed every year. But every single person doesn't need me to go to their house to reassess them because their situation is stable, nothing has really changed. That is a workload reduction for those social workers that have to see those 25,000 people. right? I don't have to come to your house. I can call you, make sure you have all that you need, and then I can go to his house because he has had more changes. That helps us to work around the growing caseload. One more thing is the IHSS Career Pathways program that the state put forward. That's a program that allows people that are IHSS providers to be able to grow beyond that profession. It's hard to get folks to be IHSS providers in general, but they don't get to grow into another type of skill so they can go make some more money so that they can afford to live in this county. So what do we need from you? Listen, this is a blitz. You know what a blitz is? If you watch football, they throw everything at you at one time. It's a blitz. Don't be and I don't like football, but I know that much. I can see it on the TV. That's a blitz. My husband is like, great job. That's all I know. Don't be distracted by the blitz, because the blitz is intended to get you off of what you should really be focused on, right? So if Kevin's feedback about the two big issues, Medicaid, Medi-Cal, Medicare, and immigration, if those are the two big issues that kind of wag the dog, focus on that. It's kind of like in foster care. If a family has an issue with caring for their kids, you attack the biggest issue and then all the little issues go away. So what are the big issues? Don't be distracted by the blitz. Take care of yourself, your mental health. Don't be overwhelmed. Don't live in fear. You're not meant to do that. You're meant to thrive. You've earned it. You're meant to thrive. Focus on those big issues. Disregard the blitz.
Thank you. I love that. I don't have a prize for my organization. To me, this is about everything that all of us are doing. And that is, I want older adults to be part of every conversation. A friend of mine has a saying, and if some of you guys might know it, and if you do, help me here. If it's good for seniors, it's good for everyone, right? Can we say that again? Because some people in the room maybe haven't heard this before. If it's good for seniors, it's good for everyone. We need to be at the table, part of the meetings, everywhere. Everywhere we go, and it can't be just the people in this room. We have to inspire others. Every one of our volunteers, every one of our family members, every conversation that's happening, right? We need to be talking about, what are we going to do for our own family? What are we going to do for our neighbors? What are we going to do for each other? We need to make sure that my prize would be that we had a whole network of people and we were at every city council meeting, every county meeting, every hearing in Sacramento, asking the question on every item. You get up at the podium during public comment and you say, how is this supporting the largest growing population in our community, the older adults? How is this policy, this budget item, sometimes it doesn't look like it's about seniors, so we don't show up. They're all about seniors. Every item will affect us in one way or another. We need to be there so that they don't forget, so that they then automatically say, oh, you know what? The United Seniors is going to come show up. St. Mary's is going to show up. 211 is going to come show up. Institute on Aging is going to come show up, and they're going to ask. I'm going to answer the question before they get here. Right? We have to find a way for all of us to make sure that we are the conversation everywhere.
So I want to echo what Faith said on IHSS. IHSS is so important to our vulnerable population and allowing people to age in place at home. It's so critical. And I know we have a caregiver shortage right now. So all of those programs associated with IHSS, please pay attention to those. Home Safe again, I'm bringing that up again because it's such a valuable tool that we use in the community just to house. In my experience, we've allowed seniors to be connected in other countries with family and to be in safer places. We allow them to be connected across the nation in other states and other cities. It's such a valuable tool to rehouse people and get people sheltered. And also, this is not necessarily a prize, but pay attention to your local city ordinances against parking and camping. That's really looking at the unsheltered population and displacing them. Because if that's going to happen, we need to make sure we have the social services and supports in place to support those people with case management and housing and everything else. So again, the connection between us having one voice and advocating. Thank you.
One thing that's really important to our organization is protecting home and community-based services. So I hope to see continued support for that. And like Kevin was saying, there's definitely concerns about that going away, or having less support. I think it's important for us to have policies that protect our undocumented clients and those who are unhoused in our community. And then I also, maybe if we were in a different landscape, this would be more of a priority, but have more support at the state level for using technology to help people have better access to resources, and also make those resources available when they do get access to them. So I'll keep it short so we can get to Q&A.
Thank you.
Yeah.
Okay, so we have about 5 minutes for Q&A. So our first question is for all of our panelists. What are the most effective state or national coalitions that you work with to protect programs and services for elders and people with disabilities?
I'll say justice and aging.
State level, you said?
State or federal.
And federal. I rely on Meals on Wheels of America, as well as NUAC for the energy and weatherization.
I think Faith made a reference to CWDA, California Welfare Directors Association.
And for us, California Department on Aging has been a great support for us throughout California.
Great, thank you. And I imagine most, if not all, these organizations have email lists and do advocacy alerts, and so we can all sign up to get more engaged and learn about what they're paying attention to. Thank you. The second question is for Levon, although others may have things to chime in about as well. So given how far along the city of Fremont has advanced with aging innovation, what would you see as an early alert on programs indicating a negative impact on senior services in Fremont?
Obviously a cut in funding. Most of our funding, we get a lot of, we're getting CalAIM funding. We're applying for some CalAIM funding. We get funding from the AAA. We have contracts from the AAA. We have grant funding from multiple sources. So as that funding starts to get cut or decrease, our deliverables have to be decreased. And a lot of that funding sponsors a lot of our staff. And so we have to look for ways to supplement that. Sometimes that's hard. And so I think we all talked about being flexible and adaptable. But really, I think that first sign of funding, and also a talk of fee for service, I believe. When you have that fee for service concept, I think that is also a red flag for there's something happening.
Mm-hmm. Thank you. Any other panelists, anything come to mind? Okay, great, thank you. And then, so our last question is Alameda County has lost almost all of their adult day programs, which impacts individuals across all incomes. Are there any plans to improve access to these valuable programs?
I think I would add that the Institute on Aging does have a social day program in the Presidio, which is far from Alameda County in a lot of ways, but we're looking at transportation options. I think something that's in our pay picture too is opening up another enrichment center in another Bay Area community. So I think, maybe I'm biased because I live in Alameda County, but I think this is a good place for us to consider that.
Mm-hmm. Well,
I don't have a good answer for that, and I'm sorry. There is a legislation day that happens at the state, and I'm involved with the California Association of Public Guardian, Public Administrator, Public Conservators. I sit on the board. And one of our charges is to go to legislation day, Leg Day. Some of you may have gone before, and it's to get in front of legislators good and to tell them what it is that you really need and why you need it. This is something that we'll take to Leg Day to talk about the lack of adult day treatment centers or daycare centers for older adults in Alameda County and in other places as well. It ultimately is going to boil down to a funding issue. You have to be able to afford to operate that entity and to be able to sustain it. So those are difficult decisions that have to be made at the state level and the county level about where you will put your dollars and what you get out of it. So to help me to be able to do that, if you hear a call for you to send a letter or for you to call a legislator at the state or for you to text, you should do that because that helps to add to the voice of when we go to Leg Day to be able to argue for what it is that we believe we need here in Alameda County, which can be replicated across the state because we're such a large, diverse county.
Mm-hmm. Great. Thank you, Faith. I think that's a perfect opportunity to end on this call to action and reminding us all of the advocacy work ahead. And also, as Faith said, to not be distracted by the blitz. I think that's an important takeaway as issues are being thrown at us on a constant basis. So thank you again. We've reached the end of our time together for this panel. It's been my pleasure to be on stage with you. Please give another round of applause to our panelists.